So our equipment, suction, oxygen, and then we're gonna have a trach care kit. Here, this is one type, this is another type, okay? Not all are made the same, okay? So you have to verify what all is in your trach care kit. You need the sponges that go up underneath the tracheostomy and the stoma, like in between the skin and the trach flanges. You'll need some, I say pipe cleaners, but you know, you'll need some little bit harder pipe cleaners in order to clean. And then you'll need some cotton tip applicators. You'll need sterile water, and then you'll need some hydrogen peroxide. Here's the disclaimer for hydrogen peroxide. It is not always used at some places. Some places absolutely prohibit it. Some places don't. Not a big deal. But the big deal that you do need to be aware of is that you have to mix it. It has to be a 1-to-1 solution with hydrogen peroxide and sterile water, because it has been shown that the hydrogen peroxide can actually damage the tissue areas. Okay? So I've got my suction, I've got my sponges for up underneath here because we're changing everything out. If my patient had a disposable intercannula, I also would use that as well. I would get an extra one the same size. So for example, this patient does not have a disposable intercannula. It is a lock-in-place one where you have to match up the dots, okay? So we clean this one differently, and I'll show you guys how to clean that one. If, for example, your patient had a typical tracheostomy tube that has a disposable intercannula, okay? The intercannula would be removed by pinching this part, taking it out, throwing it away, and getting another one, entering it in at a 90-degree angle, and gently pushing it down, and then squeezing the sides and clipping it into place, okay? You just need to make sure that when you're gathering your material, you have everything that you need. So making sure that you know what size trach the patient got, what type of a trach your patient's got is essential, and so that's part of the equipment gathering, okay? So that was this one. I'm going to put that one to the side, okay? So for example, on this one, what you would also need are new trach ties, okay? So not only the sponges, but the new trach ties, and then a trach care kit along with our sterile water, okay? All right, so we're going to go ahead and open. This is a clean procedure. It is not sterile. The only thing sterile about it is suctioning, truly. You just want to help to minimize as much exposure to pathogens as possible. In this kit, in this particular kit, it has gloves, sterile gloves, and in order to touch anything in here, you need your sterile gloves on, okay? Knowing that, you know, tracheostomy is not a sterile thing, but it is still inside the body, so it is sterile to the patient. So I'm going to go ahead and put my gloves on. I personally do it the same way that I do with suctioning. One hand is sterile, one hand is not. So go ahead and touch the cuffed end, which I can, and then wiggle around and try and find my thumb. 1, 2, 3, 4. Make sure I got 4 fingers in here. Okay. So I'm going to go ahead and put the other one on if I need to, and I'll show you. Okay, so now I can use both hands because I'm sterile both ways. I can use both hands to kind of have a little bit more control over the messiness, because it is messy. Okay. Go ahead and open this up. Here are my pipe cleaners. These just help to clean the flange. The flange does get nasty. This is to clean the non-disposable intercannula. Okay, so it's not really used that much whenever we don't have when we have a disposable tracheostomy. And here are my cotton tip applicators. Guess what? You can't find these because it's not in your particular kit that you got. Go get them. They got them in the supply room. Okay. Here are ties, but we don't use these ties. We use our actual the other ties that are much more comfortable. Yep. And then they already have this kind of split out for you. But remember, not all are made the same, so just be aware. So I just kind of put my supplies out to the side. And now what I have is an area where I could use hydrogen peroxide and sterile water. Okay, so now, because I'm going to be dirty in one area, so I'm going to make my left hand the dirty one, and I'm going to open this up if I can. Okay, pour this in there. Okay. Then I'm going to take my imaginary bottle of hydrogen peroxide, and then I'm going to pour it in there as well. It's just a 1-to-1, so equal amounts of hydrogen peroxide, equal amounts of sterile water. Okay. So like I said before we do anything, we're going to go ahead and suction the patient if they need it, so it would be sterile suction. We're going to assume right now that the patient doesn't need suctioning. And then I'm going to use my dirty hand, and I can move this off to the side. I can turn the FiO2 up because this could be an irritating procedure. I'm going to turn him up and then increase my flow to 10. We're going to pretend that says 10. Okay, so for this patient, I know that I'm going to get my hand dirty, so this is not necessarily sterile, but I'm just going to be as clean as possible. Okay, for this, I am going to unlock my trach and pull it out. Okay, and then I would put it in my solution. Okay, and then get some of the solution in there, take my brush, scrub, scrub, scrub. Usually there's nasty stuff that comes out towards the end of it. Rinse it again. I like to go back to my sink and take this, pour it down because I don't want to leave any hydrogen peroxide in there. Make sure it's all on the side. Okay, whoops, I just hit the side. Don't do that. Don't hit the side. Pull over and insert it back at a 90-degree angle, and then rotate downward, and then you're going to lock to where your dots go in line with each other. Okay, right there. Like I said, if this was a regular trach that had a disposable one, I would just take the old one out, trash it, put the new one in. Okay, here comes the stickier part. So make sure this isn't too tight because you're gonna need to move it to one side or the other. Okay, before you do anything, I like to go ahead and prepare and have my new neck collars all ready to go, because I don't like to be fumbling towards the end. Okay.
Keep in mind that everybody does trach care differently.
Yes.
So one way may work for someone, and as long as the patient gets clean, the airway is intact and secured properly, and
that you stay as clean as possible.
it doesn't matter which steps you do things in, as long as you don't get things dirty or contaminate the area.
Right. Remember too that you're always going to be holding the airway once you take this off. Okay, so we're going to move this, and then I'm going to take my cleaner hand, get my cotton tip applicator. There's one of them, and I'm going to move slightly and swipe down once. Okay, and I'm going to put that to the side. Get my other cotton tip applicator, go to the top. Okay, you're getting all this nasty stuff away from there. One thing that I didn't mention before you do this, you can use some of your clean 4x4s and dip it in the hydrogen peroxide and sterile water solution and kind of get the harder stuff off first before you go and clean the actual stoma, because that's what you're doing right now, is cleaning the stoma. So I've done his left side and on the top. I'm going to put that one to the side, get this one. Okay. I'm going to be gentle. He's going to be coughing during this, y'all. They will. I'm going to clean that side and take my last one and clean it down there at the bottom just to make sure it's all nice and clean. Okay?
Make sure that you're wiping away from the stoma, never towards the stoma, because you don't want to introduce bacteria from their neck or their trach tie back into the area, because they're highly prone to infection. And it's not wrong to use multiple Q-tips. So if you need
if you need
10,
to do it again, that's fine.
And make sure whatever you wet, you dry.
So we're a little bit wet right here. So I'm gonna take my 4x4, okay? And I like to kind of blot and make sure, wipe away, okay? I'm always holding this trach, always holding it. Why? Because I have one side that is unsecured. Okay?
And it feels really funny in their neck, and they can cough more or potentially cough it out. So always make sure you're holding it, or someone's holding it.
Yeah. So we're gotten finished cleaning. Everything looks great. I'm gonna take my split little 4x4 gauze, and you may ask, well, what if I don't have a split 4x4 gauze? You as the RT, you carry scissors with you, right? Clean those scissors with alcohol prep pads and get your 4x4 and split it halfway down the middle. That's it, okay? Is it what we want? No, because it's usually not as soft, but you kind of you compromise. So we're gonna gently put it up underneath here. I'm gonna pull out my old one so that I have a little bit better leverage here. It's getting caught in there, and see how it comes up to the top, okay? So that if the patient coughs and some secretions come out from around the stoma, it gets caught here, okay? This is my old one. I'm still holding the trach, trashing that one, getting this new one. Okay. Remember, there's 2 finger widths in between the skin, the neck, and the trach ties. So make sure it's not, this one's too loose. Okay.
And also make sure whenever you're fixing your OB sponges that it gets nice and flat against the patient's skin, not a lot of bunching, because it can cause breakdown or sores around the stoma, and that is very painful.
Okay. So now, now that Erica has secured that from me,
You want to have
she's got 2 finger widths right there.
or if you're a man with really large, like wide fingers, sometimes just one's enough. 2 is going to be a little too much. It means you're going to have to make it a lot looser, so use your judgment. If you have larger hands, you may just want to do 1 finger, but if you're like, normal sized out big hands, you probably can do 2 fingers and be totally fine.
So now that I'm done, I can have that go ahead and place the oxygen back on them. They should not be off of oxygen for an extended amount of time. This is why we hyperoxygenate the patient, so that we can kind of load them up. If you need the pipe cleaners, all this is to clean the nasty stuff that kind of gets in between there, okay? It is not to go down the airway, yes. FYI, not to go down the airway, nor to clean the stoma around here. Pipe cleaners hurt. There's metal at the end of it, okay? That's not nice. After you mess with a tracheostomy, you change out intercannulas, you clean it, you need to make sure and listen for breath sounds again to make sure that nothing has moved, that the tracheostomy is not scooted into a false pocket. It can happen more oftentimes than you think. Clean up your mess. After you verify your breath sounds, heart rate, respiratory rate, SATs, everything's good. Make sure he's fine, he or she is fine, and then you can come back and check on him the next time.